Hi, and welcome to episode 194 of the Untethered podcast. Today it's your host, Hallie, and we are diving into the question that I get very frequently. Do we need to pause myofunctional therapy during palatal expansion? So let's dive in.
Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and or medical treatment of a qualified healthcare provider. Welcome to the Untethered podcast. I am your host, Hallie Balkin. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started.
Let's dive into this. This is not going to be very long today. I know I've said that about all of the recent ones. They're a little bit shorter than usual. Last week was a little bit longer, arguably. But I get this question a lot. And I recently did a training on back on December 7th. It's available inside the Myo membership, talking about like treatment timing, order of treatment, especially when there's different specialists involved and needs, and really how it should always be airway first, right? We need airway kind of drives everything. We can't work on correct oral posture if we can't nasal breathe. Can we work on getting the tongue moving? Can we work on getting the tongue to understand where the spot is? Can we work on other things? Sure. But we're not going to achieve correct oral rest posture until the tongue can physically reach the top of the mouth, number one. Number two, it also needs to have enough space to live up there, okay? So when I get the question, do we need to pause myofunctional therapy, orofacial myofunctional therapy, while a child is in palatal expansion? That depends, okay? What kind of expansion are we talking about? Is the palate left open or closed, right? Like an ALF appliance, for example, leaves the palate open. You could arguably continue therapy. Now, if a child's really struggling and you want to give them a couple of months to gain a little bit more space for their tongue, even though it's going to take longer than that to ultimately gain all the space they need, maybe that's the discussion you have, right? What does that individual patient need? If you have, like my children, for example, had rapid palatal expanders with both forward and lateral growth components, upper and lower, the tongue is not resting in its normal position with those appliances in, and it's really hard you can't get the tongue to make full contact with the upper palate in that case. Now, for them, this was like a couple months that they were in these appliances. And so we paused myofunctional therapy because they were at a point also in their myo where they needed more space. They also you're not going to get that feedback that the tongue gets when it makes contact with the palate that says, oh yeah, hey, this is where I'm supposed to be. This is where the tongue is supposed to live, right? We're not going to have the same type of results. So it depends. It depends on the appliance at play. It depends on where you are in your myo journey. If you're just beginning myo, there's actually a lot that we work on outside of like lingual palatal suction, like getting the tongue to suction to the palate and we're not going to have it living up in the palate on day one. There are other things that we address in terms of getting the tongue to work separately, right? Dissociate from the jaw, from the mandible, having it work separately from the jaw and the lips. We work on other orofacial structures outside of the tongue as well. So depending on the goals, even with upper and lower rapid palatal expanders that may be taking up space, it may still be appropriate to continue myo up until a certain point. And then if you get to the point where you go, you know what, we got to pause until these appliances are taken out and replaced with something else, whatever this next step might be, right? It's so highly individual. The reason why I want to address this is because one, this question comes up a lot, but two, I also see like hard, fast statements that yes, we have to discontinue myofunctional therapy. And this is coming sometimes from the expansion provider, like the orthodontist or the dentist. And sometimes it's coming from the myofunctional therapist side of things. And the answer is, it depends. There's no hard, fast rule that says we have to stop for 3 months, 6 months, 9 months, a year. I mean, I hear all these different random numbers and I'm like, where did you get that from? Like, where was that number pulled out of? Because when that same amount of time is applied to every appliance and every patient, that doesn't make sense. Okay. So question what's being told and if it makes sense for you as the patient or the patient sitting in front of you, and have a discussion with the team of providers that are working on the case, so that you can come together and decide together what makes the most sense. What are the goals in Myo right now? Are there other things you're working on? Sometimes speech pathologists, for example, might be working on speech or language or accepting, expanding food repertoire, other types of things. Now, arguably, we might be waiting to work on expanding repertoire or speech sounds until we've gotten further through the Myo program. Like, that's what we typically do because we find it's much easier to address when there's more space for the tongue. The airway is patent. We know the child has certain foundational skills, or adults sometimes too, right? But what is the goal for that patient right now? And before anybody makes a blanket statement, whether it's from the myofunctional therapy side toward dental ortho or the ortho dental side towards myofunctional therapy side, we need to talk to each other as providers and be careful what we're recommending, because we could actually be disrupting the progress that is necessary for that child's case. So again, short and sweet, probably the shortest of all of them recently, but we are entering the holidays and I know you guys are probably wanting to just like relax and be with your families. If you're trying to escape them and listening to podcasts, I have plenty of others if you haven't listened to the past. This is probably my shortest podcast ever. But that is my answer to that question. And I hope this is helpful. It's something I definitely wanted to address because it comes up a lot. It depends, and it really needs to be individualized. So there you have it. All right. Hope everybody's having a great holiday season, and come hang out with me on Instagram over at Hallie Bulkin. You have questions you want answered on the podcast, feel free to drop them in my, you can DM me and drop your questions and say, hey, I have a question, that would be great to hear you talk about on the podcast, because I love doing these types of episodes that really address questions and then leave them here on the podcast so that we can find them later. And I'm not constantly re-answering the same questions or reinventing the wheel. So I hope everyone's having a great holiday season, and I'll chat with you next week. Bye.
Thanks for listening to this podcast. If you want to hear more of these Myo, TOTS, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.